Hello, my name is Dr. Chandni Nakum and this channel is dedicated to all things teeth and dentistry. I'm a dentist based in the UK and I enjoy making people smile, not only from the outside but also from within. I want all of you to be able to understand your teeth better, so I'm trying to make complex information into simple, bite-sized and an easy way to understand more about your teeth. If this sounds good to you, please subscribe and hit the thumbs up. Root canal treatment is generally a word that scares a lot of people, and everyone has heard some form of bad story when it comes to root canal treatment. So let's break this down. What is root canal treatment and why is it needed? One of the most common reasons for needing root canal treatment is tooth decay. Now, the reason for why this happens is because the decay has reached such a point that it's reaching the nerves of the tooth. So the decay is so big and it's progressed so much that it's reaching the central part of the tooth, which is where your nerves are. Now, that's what leads to the toothache that you're probably experiencing. So it's usually quite an agonizing pain, it's a constant pain, you can't sleep, you can't eat, you can't think about anything else apart from your toothache. You're probably having to take painkillers for it, and it's generally not a nice feeling. Now, when this happens, it means that the decay has reached inside the nerves of the tooth. So in simple words, it means that the decay is causing the nerves to become infected. Now, when this happens, a standard filling isn't enough to correct and to get rid of that toothache anymore. Because the decay has reached to the nerves of the tooth, the nerves themselves need to be cleaned out. So the root canal needs to be cleaned, and that's why you need a root canal treatment. Another reason for why you might need root canal treatment is if you have decay underneath a filling. Now, this usually happens with fillings that are very old, and the reason for that is because there is a gap, a very tiny gap that develops between the natural tooth and the filling. And so you get food and bacteria stuck underneath there, and then that's what causes decay to progress under the filling and then leads to the same kind of issues of the toothache and then needing a root canal treatment. Another reason for root canal treatment is trauma. Now, you might have had a nasty bump or a fall, and that means that you might have broken a tooth, but the tooth has been broken to the point where there is a direct opening into the pulp of the tooth, which is, like I mentioned, where the nerves are. So in order to basically try and save the tooth, you need to have a root canal treatment. So what is root canal treatment? It's the process of which we clean out the pulp of the tooth, which is where the nerves are. Now, this is basically the root canal system. So how we do it is a very step-by-step methodical way. First, or the number one step, is to clean out or to find the nerves of the tooth. So what we do is, if there is a filling or the tooth is broken or if there has been previous decay in the tooth, all of that is cleaned out first. So we make the tooth as clean as possible, and then it's all about assessing the restorability of the tooth. So what I mean by that is to look at the amount of natural tooth that is left and to think, is this tooth savable? Is there enough tooth still left here for this tooth to still have a lifetime behind it? Now, this is very much dependent on the dentist's judgment. So generally they would have already have decided if root canal treatment is the right option for this tooth, but sometimes it's not always possible to know until we've cleaned the tooth out. So that would be the first step. So step number 2, after cleaning out all of the decay from the tooth or the previous filling, we then make a small hole into the nerve of the tooth, so that the pulp system of the tooth. Now, the reason for that is because firstly, we need to locate where these root canals are. Secondly, it really helps to reduce the amount of pain you're feeling. Now the reason for that is because the toothache generally happens because there has been such a build-up of pressure inside that tooth. So by making a small hole in the tooth, there's a release of the pressure and you'll feel a relief of the pain that you're having. Now this all might sound really scary to be making holes inside your teeth, but you will be completely numb throughout all of this, so you won't be able to feel any pain. However, in some situations, the tooth itself can be really inflamed, and if that happens, it can mean that the anaesthetic doesn't work as well. So sometimes you might feel some discomfort during this procedure, but always remember the end goal. This pain is going to be a lot less than what it was to begin with. So once we've found the canal openings of the tooth, we then start to clean out the tooth. So we clean out the decay and the infected nerves and the dead nerves from the root canal system. However, if the tooth is inflamed, or depending on the complexity of the root canal system, we might put a paste inside the tooth. Now this paste has a calming effect and a soothing effect on the tooth, which is really, really helpful if you have got an inflamed tooth, because it will help the pain to settle so that it's not as painful for you when you come back for your root canal treatment the next time. So what we do is put the paste inside the tooth, seal the tooth, build up the tooth with a temporary filling material so that it's easier to come back into the tooth when you come back for your root canal treatment at the next appointment. However, if your dentist feels that they can continue with doing your root canal treatment in one appointment or in one go from start to the very end, then you can basically skip that step of the paste. Step number 4 is cleaning out the root canal system of the tooth. So to do this, we use a cleaning fluid, and that helps to clean out all of the dead nerves, the bacteria, whatever's been causing the toothache to happen. To do this, we put a rubber sheet over the tooth so that only that tooth is exposed to the cleaning fluid that we're using, and I'll also use some metal files to help to clean out the tooth as well. Step number 5, so after cleaning out the root canal system as much as we possibly can, we then fill the root canals with a very thin rubbery material. And this is so that the bacteria that still might be remaining inside the tooth don't have any room to grow anymore. So the final part of this treatment is to recreate a tooth so that it can function well. This is dependent on several factors, some of which are how much tooth is actually left, so how much natural tooth have we still got, and even whereabouts is this tooth in the mouth. So is it near the front or is it near the back? So once you've had root canal treatment, generally the tooth is weaker than it was before. So we want to put something on top of the tooth that's going to make it last as long as possible. Examples of this can be something as simple as a filling, or it can be a bit more complex, a bit more like a crown. But this is something that your dentist will describe and speak to you about in detail at your appointment. Let's talk about some stats. So if you are having root canal treatment for the first time on your tooth, it generally has very good success rates. You're looking at around something between 80 to 90%, which is pretty good. If you're having re-root canal treatment, which means your first root canal has failed and so you're having to have another one, the chances of success are a little bit lower. They're around about 70 to 80%, but again, very good. So as you can imagine, root canal treatment can get very complex. Now, in certain situations, the shapes of the root canals can be really, really curvy, or they can be twisted, or the canals can be extremely fine, or they might even be blocked. Now, in many of these situations, it might be easier to be able to refer you to see a specialist, which would be a private treatment, or via the NHS. If you found this video useful, then please hit the thumbs up and please subscribe. And if you want me to make any other videos for you, then please write that in the comment section below.